Welcome back to the Now Morning Show, where we're broadcasting to you live from the Hyatt Regency as we get ready for the regional symposium, Violence as a Public Health Issue, the Crime Challenge. Now, on day one, the Executive Director of CARF is expected to make a presentation, and she's here with me this morning to give us, hopefully, a little bit of a tease into the presentation. Good morning, Dr. Joy St. John.
You're not going to get it out of me. I knew you were coming with that.
You start off with, how are you doing this morning, Dr. St. John?
I am so excited to be here. This is an amazing event. I anticipate all kinds of innovation. I anticipate regional solidarity. And I anticipate that there will be the start of a process to develop a new approach. And we need it. It's not just the Caribbean, it needs it. It's the whole world.
Now, as the Executive Director of the Caribbean Public Health Agency, I've read that public health is the science of protecting and improving the health of the people and their communities. Is that the approach that we're taking when it comes to violence and to crime, in this symposium at least?
That's part of it. There's a lot more to public health. And what I am hoping is that all of the tools that we use will be brought to bear. And I'm also hoping that the role and function of public health, especially the authorities, the ministries of health, that those roles and functions will be better defined and integrated, because there's a lot going on at the national level. But a regional approach is a different thing.
It definitely is. How do you see the integration happening in terms of health, or the ministries of health, for example, and national security and crime prevention? How do you see that integration happening?
Well, I want to hear what comes out from the deliberations. And then next week, the chief medical officers and the ministers of health are meeting for official CARICOM meetings in the Bahamas, in the margins of CARF's annual health research conference. And I really want them to have a chance to put their stamp on it. Now, I have a regional remit, it is true, but I never like to presume. But there are certain functions that are already ongoing. People who are hurt, people who are victims or perpetrators, they pass through the health system. How do we treat with that? How do we support surveillance? Do we need to create totally new indicators for monitoring what is happening in the Caribbean and the success of the intervention? These are some of the things that I think will need to be discussed and formalized and agreed to support for the health support of the political declaration that I am assuming will come from today and tomorrow.
What is the role that you see CARF playing in all of this?
Oh, CARF has many roles to play. That's part of the reason why I am excited. I mentioned to you the annual health research conference. So fostering research so that there's evidence-based decision-making, that's something that we can do. We have a network of research ethics committees, so we can make sure that this is ethical research. We can support also in the surveillance. I told you about indicators, designing those and monitoring those. And we can help with the coordination of the public health effort, because this is regional. So we're going to have some consistency. And the other thing that CARF would be very happy to do is to support from the health security perspective, just as we use the health security perspective in how we supported the region in fighting COVID-19.
I just want you to get into a little bit of what health security is.
Well, just like there is security, the regular forces, the uniformed or armed forces, health has a role. And in the same way that we may be monitoring a disease, we can monitor injuries. We can monitor intentional injuries and violence. So this health security is all about preserving that health for the individual and the community, even if it is something that is challenged by violence and crime.
But isn't that approach more of a after the fact situation? So we get to the health. I mean, the victims, for example, would get to healthcare after the attack has already
Very
happened.
good.
So how do we get to the preventative stage, and can CARF play a role in that prevention?
Yes, and that is part of what I want to present today. So try as hard as you can. You're not going to get it out of me.
It's very interesting. You know, I just trying to ask the questions. And
I know.
You're just refusing to answer.
No, because you're not gonna hear it before the heads of government. Not gonna happen.
Okay, I understand. But your topic is crime and violence, a public health approach. And some of the things that you're mentioning here are definitely an approach that is integrated with, you know, the health systems across the Caribbean, across the region, as well as, you know, what we need to do in order to monitor, for starters, the situation. The minister just now was speaking about all the statistics about our local hospitals and, you know, the violent crimes that have been reported and things like that. So is it that we need more collation of that data going forward?
Once you're doing regional, we cannot be working as silos.
Right.
We have to have data sharing, and we have to know what to measure, what to monitor, to ensure that the right data is coming through to those who need the information for program evaluation and policy development.
And you mentioned at the beginning how excited you are for this two-day symposium that's happening. But what do you hope comes out of it? Just unification of the Caribbean coming together to say, this is how we're going forward, or do you expect more?
Well, I'm coming off the acute phase of the pandemic, and the Caribbean region was supposed to be one of the most vulnerable that could not do anything. And we came together in a way that surprised people. We had less illness and death than was expected, and shock of all shocks, our main money earner, tourism, bounced back in a way that was not predicted. And so I want something sustainable. I want something resilient, and I want something that is specifically Caribbean.
I always wonder what that means.
Caribbean?
Specifically Caribbean. Because we're so diverse in the Caribbean.
No, there is diversity, but one of the first things about us is that we're small. And not many people understand small systems. Not many people understand how to work with ministries and to get the best even when there's very little. Not many people know how to massage the culture of the Caribbean, because although we are different, there's certain elements we share alike. Basically, at our core, we like each other. We are aggressive congregators. We like to have fun. But when we're serious, we get down to business. And we can make a lot happen with very little. And that specific Caribbean approach is something that we like CARF for the CARICOM institutions. We need to change our tactics so we respond to that. And we get more out of the region than anyone expects.
And that's where the policy changes come into play.
The policy changes and also programming. But most of all, the regional solidarity.
Do you see any challenges with getting that regional solidarity together?
Of course.
Tell me some of the challenges that you foresee.
But you spoke about the diversity. And we're also fiercely protective of our own. So even though we're small, we still see the separations. We still want to preserve the differences. To break down that isn't always easy. But if there's a common vision and there is the technical and administrative expression of the political vision, we can get it done.
Oftentimes when we speak about political vision, we have to consider levels of corruption. And that is a part of crime as well. How do you see, what role do you see, or if any, that corruption, political corruption or business corruption, or any sort of level of corruption and crime playing in the challenges that we face?
You speak in a language that I don't understand. I don't deal with corruption.
But it exists.
But what you want me to say, I can't say because I just don't have the reference. Sorry, try again.
Okay, so as far as you can see, that's not playing a role in what we have to do going forward.
I just am not an expert on it,
Yeah.
and so I cannot speak to it.
Okay, I understand. Well,
Can
as
you
we get,
ask me a question that I can answer?
I asking you questions and you refusing to answer them. I don't understand.
I know my limitations.
All right. So tell me, and then in your expertise, we're seeing in this symposium that crime and violence is indeed a public health issue. How did it become that?
I think crime and violence has escalated and diversified in a way that it is causing even more health threat. And it is causing a health threat to all ages and sectors of the society. And by that definition, the fact that there is so much harm to the society, it must become a public health issue. It's also something that interacts with the public health system. I would have mentioned, and also the minister before would have mentioned, the impact on the health services. And so whenever you see that level of mayhem, it becomes a public health issue. It doesn't mean that we are going to take over from the security and the judiciary. No, we are going to integrate. But it is acknowledged in this title that it has become that level of threat to our quality of life in the Caribbean.
Yeah. Is there any particular presentation outside of your own, of course, that you're looking forward to seeing or hearing about today or tomorrow?
Today is so packed with things that are interesting to me. I really don't want to miss anything, but I definitely want to hear from the member states. In public health, as a practitioner, you need to hear from the people who are experiencing to get their perspective and help to design interventions that are relevant.
All right, and we look forward to those conversations. We look forward to your presentation as well on crime and violence, a public health approach. Even though you're not giving us any teasers into what you'll be talking about, we still look forward to the conversation because I think it's definitely one that will help us get to where we need to go in terms of developing the action plan, in terms of implementing that action plan going forward. And I want to thank you for coming out here early this morning and joining us on the Now Morning Show to be able to chat about what we expect to happen today and tomorrow.
You're welcome.
Do enjoy the symposium and do enjoy the rest of your day.
Thank you.
All right. Ladies and gentlemen, you're tuned into the Now Morning Show. That's Dr. Joy St. John, the Executive Director at the Caribbean Public Health Agency, CARF. We're going to take a quick break, and when we come back, we still have more inside the Now Morning Show, so stick around.